represent about 600,000 people, about 500,000 are uninsured. 17,900 businesses would be eligible for affordability credit or tax credit, as we call it. 11,800 seniors avoid the donut hole. Senior citizens understand donut hole well. We passed Medicare Part D in 2003. I did not vote for it. But anyways, in 2003, they created a Medicare prescription drug plan. The first 25, you're paying your monthly premium. Once you hit $2,500 in cost, you can continue to pay your premium, but you have to pay for your prescription drugs 100% out of your own pocket until you hit about $5,700, $5,800, then you come out of the donut hole. Why do you put a donut hole in? To be able to make it affordable. Most seniors hit the donut hole about June or July. And then probably June, July, September, October, they're in the donut hole. They're paying for an insurance policy that provides them no coverage. They're paying 100% of their premium on their prescription drug. Then they come back out of the donut hole if they hit $5,700. We're going to close the donut hole. I always thought that was unfair. Ask your hospital here, Sprius there, on Ontonagon, how much do they have in uncompensated care per year? When you take it around the first congressional district, health care providers, if everybody was receiving something for the health care that they provided that patient, it's worth about $185 million for the first congressional district. Let's go just quickly. I think we debunked a lot of these myths. There are no death panels. No one's going to pull the plug on grandma. That's a cruel distortion, as the AARP said. Illegal immigrants. Everyone says illegal people are going to be able to exploit this bill. Section 347, that's the exact section right out of the legislation. Nothing shall allow federal payments for affordability tax credits on behalf of individuals who are not lawfully in the United States. Section 1786, called the Space Amendment, that's after Zach Space out of Ohio, prohibits Medicaid and Children's Health Insurance Program coverage for illegal immigrants. The manager's amendment, the final bill you voted on, also had additional requirements for verification of your citizenship to make sure you're legally in this country. Another fact that we're going to force people into government-run health care. We're not forcing anyone. Public insurance is an option. It's created to create some competition within the insurance industry. We increase choice between private insurers and public option. Government option, according to our research, about 40 to 44% right now of all Americans are on a government option health care system somehow. Medicare, Medicaid, Department of Department of Defense, Indian Health Services, Children's Health Initiative, all federal employees are under a government sponsor. You're probably even greater than that because you got county, government sponsored, state, government sponsored, school board, government sponsored. According to the Senate, they think that's figure as high as 60% of American people right now actually get their insurance through government-sponsored insurance. So we're basically building on the system that already exists. All right, I'm going to get the right buttons here. How are members of Congress affected? Some senators put forth a proposal that no members of Congress would have to come underneath the National Health Care Bill. It was never a proposal. It was never an amendment. It was never considered. We're treated the same as any other federal employee. There are 4,600 federal workers in northern Michigan, from Fish and Wildlife to Forest Service to you name it, Department of Justice, you name it. They are offered the same insurance that are offered to members of Congress. Like anyone else, if this passes, they would choose